All right, so thank you. So we will start, like I said, our discussion today is going to be focused on formulating research questions, right? So it means that it's expected that at the end of this session, each and every one of us should be very, very familiar, with the idea of, formulating a very decent research question. So it's going to be a very interactive session, and I hope we really, really have a very great understanding of everything. So let's get started. So once again, my name is David Chinechom Innocent. So I will be your facilitator for today. Maybe tomorrow we will get to hear from other team members who are also wizards in in the aspect of systematic review, particularly in the aspect of gap identification and all that. So it's a pleasure. Like I said, I've been a systematic reviewer the past 6 years, of mentored a lot of PhD students, published in diverse journals. I've also written numerous PhD systematic review dissertations. Systematic review has been something that is very valuable. Like if you can remember, yesterday we talked about research paradigm, where we argued about the need for you to be a systematic reviewer, looking at the hierarchy of evidence. So if you're here and you're thinking about how to perform your first systematic review, or you want to start writing systematic reviews, I want to tell you that this is the right place for you to be, right? So the idea of this training is that we have made it we put up all our information in details, rudiments by rudiments, right? We don't believe in teaching, a full systematic review course in one day and you don't understand it. But we believe in making sure that when it comes to the aspect of research questions, you have a detailed knowledge on that. When it comes to the aspect of eligibility criteria, you have a detailed knowledge of it, right? So that if it happens to be that you're a breastfeeding mother, or you're a PhD student that has children, and your children are actually participating in this session, we want to make it rest assured to you that your kids, if they get exposed to this video, they can start formulating research questions. As a matter of fact, we ask people questions every day, right? So before you came to this meeting today, I'm sure that you've asked people tons of questions, right? You've put yourself in the aspect of asking a lot of questions, and this is something that is very, very important for us to understand. Now, so we'll be moving ahead, beautifully, in this particular concept. So our outline today is we're going to be looking at, first of all, we're going to have a parenthesis, about the research question. Just like I said, I'm sure a lot of us have asked yourself diverse questions. Maybe somebody met with a girlfriend today, maybe you're like, hi babe, why didn't you come back early? Hi, why didn't you get the food ready? Hi, why didn't you do this? Hi, why didn't you do that? Hi, why didn't you, feed the kids? Hi, why didn't you? A lot of questions out there. A lot of questions has actually been put out, and we need to understand that all these questions that we keep on asking people, right, are questions that can be suited, that can be narrowed down, with a very, applicable framework. So we're going to start by understanding what does the research question mean, right? So what are research questions? The systematic reviews. What are types of research questions? Then we're also going to look at the models and frameworks that are used in shaping our questions, right? Then we're going to have a detailed baby approach, something I call the infant method of starting your systematic review. I'm sure somebody here wants to start his or her systematic review today. You want to start writing a systematic review today. And from our session yesterday, you already have your paradigm. where you're standing, your position now, but you want to formulate a question, so don't worry, you're going to have that. So also going to look at examples and a couple of practice questions that will put us into action. So it's expected that even a kid, will be able to formulate a question decently, and it doesn't matter whether you're a PhD student, it doesn't matter whether you just started writing a manuscript, this is something that is going to be really, really exceptional for you. All right. Wow, so this is a very beautiful dog. I don't usually like dogs, the dog is asking a question. What's your question? And I don't even really know what this type of dog wants to ask, because he looks, well taken care of. Those type of dogs that are at home that have you making a lot of comments. Maybe your dog is misbehaving. You have a dog at home that is undergoing mental therapy. Instead of the dog to help you to reduce mental stress, the dog happens to be asking you a lot of questions, and that's very crazy, right? Ouch! So it just looks like the dog has just gotten married, right? So it sounds very crazy. Like, we just saw a dog that is asking us a question, and the dog seems to be married now to the couple, and interesting. So we might need to know some of the questions these two married couples dogs happens to be asking themselves. So that looks fun. Okay, now this is going to be what, if you can remember in our outline, we talked about something of being a brain teaser, right? So don't worry, everything that you find in the bracket here are going to be explained in details, right? Because basically, we get to see a lot of PhD students, maybe just started doing your PhD or your master's, or maybe you're an undergraduate student and you want to start your research, and your supervisor is telling you what you should do and not what you maybe particularly feel like doing, right? So it's still possible for you to find a way to put in all those questions that your supervisor has asked you to do, or maybe your supervisor has asked you to work on breast cancer, maybe your supervisor has asked you to work on maybe marriage as a topic. It's very important for you to find a way to align it to a particular framework. And this is something you must find in the systematic reviews, particularly if you're doing your systematic review dissertation. Let's say you happen to be doing a systematic review dissertation, right? It's very, very important for you to know that your systematic review question must be aligning with the framework. So what do we have here? So we have the question. Let's just go through the question that the dog is asking the spouse. So it's asking, what do couples who attend premarital counseling, right? So here we're looking at premarital counseling, think about the benefits, phenomenon of interest of these sessions for their future marriage. So we don't bother about what this means. We're going to explain it on the long run. So you might get to know what this actually really means when we have to come back in. So the second question from the dogs is that they're asking themselves, for newly married couples population, does attending premarital counseling, now, an intervention which is given to them? Maybe you want to go for a session, right? So they're asking whether does attending that compared to not attending, that's maybe compared to other couples that don't attend. So we'll get so many people who get into relationships, a lot of ships out there, I've never been in one. Yeah, actually. So, and let's say they just start up a relationship and no dating and no proper questions. They don't compare themselves, they don't put themselves into a comparative approach that can let them make better assessment, right? So compared to not attending, some of these sessions, does it improve marital satisfaction in their first year of marriage? So this is actually a very interesting question that you might have asked somebody today. Let's say somebody just started your PhD and you're trying to combine your PhD with dating. This is a lot of questions out there that you get to ask, but you don't know that these questions can actually be put in a framework. Now let's look at the next question. So how do newly married couples in a population who face early financial stress and exposure experience their relationship outcome in the first segment. So this is also another question which we also understand the type of model and the type of question this happens to be. So I just want us to have these questions in mind, while think about this dog, that just got into marriage. Just think about this dog. That's a very nice, fine, beautiful dog. I think this is the wife, or maybe this is the wife, this is the husband. So then the last question there is for couples planning their wedding. Maybe that's population couples who are planning wedding. What are the common stress factors, concept during the planning process? So this is also another question. So just like I said, we ask ourselves a lot of questions every day. You should, as a matter of fact, today you might have asked somebody, at least a human being asks not less than 10 questions, a day. And it is very, very important for us to, put this into what consideration, right? When we are what? When we are doing our proper research. Those questions that you're asking, you need to think about the model. How does this question shape my belief? What is my paradigm for this question? And what type of question am I asking? And how did I come up with this question? Right? These are the pertinent things we really need to do it, understand. So that's, by the way, that's enough of the dog. That's enough of the joke, about the dog. So now let's understand, properly what a research question means. So a research question is just something that is clear, right? It's focused, and it directs what we want to go and do in the field, right? So whatever thing you want to do, coming to school, carrying out your project, it's based on a question, right? So a research question is the same thing as your topic. When you're asked a question, when somebody asks you, what is your PhD question? What is your undergraduate question? What question did you answer during your undergraduate school? That means what? What is your topic? Is the same thing as what? Is the same thing as what? Is the same thing as the topic. I hope you can hear me clearly.
Yes, we can hear you clearly.
All right,
Yes, we
beautiful.
can hear you.
Yeah, beautiful.
Yes, sir, we can hear you.
Yeah, thank you. So now, when you say, when you're asked what is your question, right? When you're asked what is your question, what question are you seeking to address in your research, right? So it means your topic. So they are the same thing. So just imagine you're figuring out which toy is the best, right? So you want to know which toy car goes faster. So this is a question you might have asked a child today. There are a lot of toys in the room, right? So which of them goes faster? So the question there is just you now deciding to know which one. Is it the one on red color, or is it the one on green color, or is it the one on purple color goes faster? So this is just to call in our mind on what a research question seeks to be, right? So when you're asked a research question, it is not different from your topic, right? So when somebody is saying, I need to formulate my research question, in the right sense, what it means is what? Your topic. So we can have in a scenario in the project, in your project, where we can have your research questions aligning with your specific objectives. They are still just the same thing, right? You can, but in the context of a systematic review, when you ask, what is your sole question? What is your major question? It means your topic. So when we are saying how to formulate a research question, the essence of this training is to make sure that at the very end of this training, you've developed that ability to formulate as thousands of topics. In short, in our 16th slide, in one of our last slides, from the information we are going to pass, you're going to have the ability to formulate 21,000 research questions in 1 second, which is very possible. You're going to have the ability to formulate 21,000 research questions in 1 second. So it means that when you're looking at your your wife, or you're looking at your girlfriend, or looking at your lecturer, or you're looking outside the door in your class, you're seeing a lot of questions that are not answered. And the essence of this session is to now help you focus those questions with a model. Use those models to shape your questions. Right? Good. So it's not different. What I said in my last slide is not different from what I'm going to talk about here. Research questions in a systematic review, just like big questions you want to try to answer, right? So, what is big? What is the prevalence of cervical cancer in Africa? That's a big question, right? So, for you to address that question, you will like, oh, I think a lot of women, maybe you just finished watching TikTok, right? A lot of us here, all we do most of the time is watch TikTok, sleep in the night to rest your brain, wake up in the morning, watch TikTok again, go do your research, watch TikTok and sleep. So maybe when you were watching TikTok today, you saw a lot of videos of people who were showing symptoms of polio, right? Then at the end of the day, you're not like, this polio seems as though it's in Africa location. This thing seems as though it's among Black people, maybe Nigerians, setting or location, right? So maybe it seems to be among children, population. Maybe they're exposed to maybe air pollution, maybe one or two variables of concern, right? And maybe it seems that it is bringing about deaths. That way, you've watched one video on TikTok, you formulated one research question. So what is a systematic research question like? It's just like, it can be a broad scope. Maybe you're in India, it can be a broad scope, right? So maybe you're looking at let's say dementia among patients, among African patients in the UK. And so maybe they are working, maybe from the experience now is what? Interpretivism. That is maybe from the thoughts or from the stories you've been hearing from your friends, right? A lot of people are talking about dementia, that a lot of Africans who are in the UK are mentally depressed, right? So that way, you can formulate a research question and you have a topic, you have a question, big question. So the next thing you need to now start talking about it, how to narrow it down, how to shape it, how to put it in a better shape to make sure you're able to do what? Address your question. So formulating a research question is very, very easy. It's very simple. It's something you can teach your children. So I personally told one of my friends, or best female friend, I told her that my children, I'm going to start teaching them how to formulate a systematic review start formulating a research question from pre-nursery. It's possible. Hi, Alex. What did you learn today? I learned this. So what problem do you think you can find? Okay, I learned that this toy can affect this toy. That way, she has a question that is seeking to be what? Addressed. So we need to see it as something that is very simple and easy. Immediately you step into the what? Method. So this is what systematic review is all about, right? So if you look at the last bullet, it's just all about gathering evidence from a lot of studies. So there might be a lot of studies that has been primary studies that has been conducted in the UK about dementia, right? Maybe some among Asian patients, maybe some among a lot of persons. So at the end of the day, you now collate those studies and summarize them together. That is what a systematic review is. But then, for you to have that research question, it means that it has shaped your thoughts and reasoning. So now we're going to talk about the methods of. I literally talked about this yesterday, but it's still important for us to have a look at it, and we're going to understand the reason why we need to see this, right? So this is more like the types of research questions. So research for all the questions you ask in this world, all the questions you ask your ex, be it your ex, be it your dog, be it your kids, be it your husband, your wife, your classmate, your lecturer, whoever it is classified under three tiers, right? It can either be that you're asking that person a quantitative question. So let's say, for example, you're asking somebody a question like, how much do you read in a day? That is a pure what? Numerical, right, question. And let's say you're asking somebody a question, maybe you're asking a person, how do you even experience reading in a day? That is a what? Qualitative what? Question. Now maybe let's say you might want to combine a question that you're asking somebody. You might ask the person, how much do you read in a day? And how does it even affect your past experience of reading? That is a what? Mixed method what? Research question. So what you need to understand is just very simple. That any question that you ask in this world, whether it is in the Bible, it's the Holy Quran, is in any type of book, holy book, right? All the questions that were asked to those prophets were either a quantitative question or a qualitative question or a mixed method question. So when you open your scriptures now and start looking at the questions that God is asking you, right? He's either asking you what? A quantitative question or a qualitative question. So we need to see research beyond coming inside the classroom. We need to see research questions beyond just interacting with your friends, so that because this also happens to making money and business ideas. Because when you only talking about money when you go for business meeting, I don't talk about maybe research, maybe when you meet with your friends, or maybe when you're playing with your girlfriend or you're playing with your toys, right? You need to think about what kind of experience am I having compared to others. So that is just how it is. So when we talk about quantitative research, right, it's numerical, it's generalizable. So it's like I talked about in our previous session, right? We talked about quantitative questions as stuff that deals with surveys. So what are surveys? Surveys can be cross-sectional research, it could be cohort, it could be any type of before to after studies. There's something we call before to after studies. So before to after studies are like cohort studies. So it can be random, whatever type of studies that deals with comparison of impact and what quantitative questions. And then the same thing applies to qualitative, no, different, sorry, in contrast here for qualitative, it's more of what experience, deals with more of interviews, right? So it just tries to, it doesn't really look at numerical precision. So what we mean by here is that you can't ask somebody how much time, how many times do you take your bath in a day? You might have asked somebody that question, right? And that question can be coming with any model that we're going to look in our future session. So in that situation now, that question is a quantitative question. But what it means that going beyond that now is that you begin to ask that question, how do you even experience not taking your bath in a day? What does it feel like? That is when it becomes a what? Qualitative question. But when you ask somebody, how many people in this class takes their bath every day? Is a survey. You want to take a survey with a questionnaire. You want to do a cross-sectional research. You want to ask a lot of people questions, measure it, and then come up with a conclusion, a generalizable conclusion, which is telling that 24% of people in an Indian class maybe rarely take their baths, for example. Or maybe 25% of people in a Kenyan class rarely take their bath, or maybe whatever, right? So that is what we mean by what? Quantitative questions. So we need to pay close attention to quantitative research questions and the type of models that it aligns with. So in our mixed method here, it's just all about having a holistic approach. So what we mean by holistic approach here is right. So more like we try to combine this approach. So we're not just considering one method, right? So we're also looking at another method, right? So it's more like blending theory with quantitative research. So this is just combination of this and that. So maybe you might be asking people in a survey, let's say you're doing your primary research, you just started your undergraduate project, and your supervisor is telling you that you have to do a mixed method study, right? So you need to do interviews and also collect questionnaires. So in that situation, maybe you might be asking people, exploring the perspectives of women towards antenatal care. Maybe you might sit 30 women down, right? In a qualitative research, usually a smaller sample size compared to quantitative that have larger sample size. So here, let's say you might sit 30 women down, right? And you're asking them, how do you experience, what was your experience of antenatal care service? So everybody have what they are narrating, right? And also, in addition, you're also asking questions like, you now give a questionnaire to 100 women and maybe you send it across on WhatsApp and start asking them questions on, maybe level of that's the amount of time they attend antenatal care sessions. So that's way now, you're coming up with a numerical question, right? So that is what we call a mixed method using both quantitative and qualitative. So we're going to look at those research questions. So how do we start? So that's the question. Somebody is like, so how do I start? Maybe you want to cry, like the dog that just got married, in our earlier session. They're like, how do you start, right? So don't worry, we're going to explain how you're going to start, to formulate your research question. But then, now we need to look at what we call models in formulating our research questions. Now, many times in most primary, stage of, that's when you come to university in your undergraduate days, right? 90% of times, your supervisor doesn't sit you down and tell you of a model to use in formulating your research question. Think about most of us in West Africa here, right? 90% of the time, you just come up with a research topic and you don't even know how you came up with that research topic. So formulating your research question in this context, it doesn't really just stop with your systematic review. It also applies to any type of research, not just research now, any kind of question you're asking somebody on the road. Let's say I pull up with my car right now and I want to buy food at the restaurant and I'm asking a lady who is there, I'm asking her how many plates of rice is remaining there. That question is suited with a particular model, and we are going to explain those models in details to give us that deep understanding of how to formulate our research questions, right? So we can now formulate 21,000 research questions in 1 second. Seems possible, right? Okay, now we have what we call the spider model. Don't worry, I'm also going to explain it with other real examples in your healthcare research questions. So we have practice questions at the end. So don't worry, you're going to have a more detailed, understanding of it. But now we need to understand the fundamentals of those models. Now we have what we call the spider framework. Now, remember in our previous session, we have explained that for qualitative research, right? For qualitative research, it mostly deals with interpretivism, right? Good. So we understood that clearly, right? So if you didn't understand that, we also have our videos of our video of our last session. So recorded, so it's also going to be sent. It was sent across to us, so you can watch that. Now, most of your research questions that are dealing with qualitative questions, you need to use what we call the spider framework. So we had a situation whereby you see a PhD student has a question on a quantitative question and you're trying to force it in with the spider framework. Now, understand that there could also be other interchangeable differences, right? So it's just like your doctor telling you, maybe I'm your doctor now telling you what you should do. Maybe you might go to meet another patient or another doctor elsewhere, and the doctor tells you, maybe that doctor could be your supervisor, and your supervisor can tell you, no, use a PCC framework to do your question. It's still fine. It's still fine. But what we need to understand is that the spider model is used mostly for any type of question you're asking somebody that is trying to explore the person's why, how, emotions, feelings, right? So the spider framework is mostly using it. So now what does that spider? Spider means S means sample, PI means phenomenon of interest, D means design, E means evaluation, arrow means the type of research, right? Now, so here that it means for sample, it could be what? Who are we studying? So it could be kids who play video games, right? Phenomenon of interest, who are we interested in? What are we interested in? It could be that video games, right? So this is how we came up with the topic, right? Now, in our design, why do we want to study it? If we want to use surveys or interviews, remember I said that sometimes it can be used interchangeably, but we need to understand that it's widely used for what? Qualitative research. Now, in terms of the evaluation, what are the evaluation can also be known as outcomes. What do we want to find out? So we want to know if playing video game helps or hurts their grades. Now, research type, what kind of study is this? So it could be qualitative, so it's mostly qualitative. So it could also be mixed method. So it could be a mixed method question that you're trying to address. So in that situation, you have to use the word spider framework, right? So it means that, let's say I want to do a topic now on experiences of women, towards antenatal care services. So in my sample, it's going to be what? Women who are attending antenatal care services. So phenomena of interest could be what? Maybe antenatal care services, right? Design could be what? I'm looking at focus group discussion. I'm looking at case studies. I'm looking at phenomenological studies. All types of qualitative design studies that uses interviews, right? So in my evaluation, I'm looking at their experiences. I want to find out their experiences. Research type, qualitative. So you see how I just came up with a question now, and I've just matched it, aligned it with a model. Now, the essence of using a model in formulating your research question is that when you use a model, it makes your question more what? It makes your question more comprehensive. It gives you that quality of evidence, to the nature of your research question, right? So that is why it is important for you to use a model in formulating your research question. Now we're going to look at another type of model that we usually use, which is known as the PEO. So this is also another type of model. It can be used for any kind of question, both quantitative and qualitative, right? So we're also going to see practice examples. Trust me, there are loads of examples out there, right? So for example, population, who are we focusing on? Teenagers who use social media, exposure, the amount of time they spend on TikTok, because most of us here actually like using TikTok, like, right? So then the outcomes, what do we want to see, right? So all your research question must have an outcome. So if you look at this previous example here, our outcome was more of our evaluation. So that's for our PEO framework. So we're going to look at what we use mostly for quantitative studies. So we have our spider, which is mostly for qualitative, and we have our PICO for mostly quantitative studies. In short, imagine me catching you using PICO for a qualitative study talking about a space. I'm going to shoot you like this boy. Do you see why this boy? The reason why this boy is holding this gun is because he wants to shoot anybody that is going to use the PICO framework wrongly. And as you can see, he has his friends who is going to shoot you, the snipe with them. So the P there means population, right? So who are we studying? Maybe adults with back pain. So we look at our intervention. I is more what treatment action are we looking at, right? So maybe these adults, maybe the topic now might be adults with back pain, who are actually trying to exercise themselves compared to other types of exercise. Now let's say now their comparison here to explain it more better is maybe comparing traditional exercise or no exercise at all. Now don't worry, many times when you're formulating your PICO, your question, your research question using the PICO framework, you get to realize that the comparator might not really reflect in the topic. I'm going to explain what this means, right? The comparator many times and the outcome might not really reflect in the topic. So let's say for example, this topic now is we want to know the effectiveness of a new type of exercise in reducing back pain among adults. In that situation, now it means that for you to determine the effectiveness of any intervention, there needs to be a comparator. So it means that you now know that your comparator now is maybe other traditional exercises. Don't worry, you're going to explain this, you're going to understand this in details when we look at numerous research questions. So our outcome here is, what do we want to find out? Does it reduce back pain or not, right? So we can look for an example now, another type of quantitative study now that might not really be suited for this. So the PICO framework is usually used when we are trying to formulate any type of quantitative study that deals with effectiveness. So just to have it in mind, particularly if most PhD students make this mistake, you're doing a systematic review that is looking at trying to compare two drugs, right? And you're using a PEO framework. Now, when you're trying to, let's say, effectiveness of paracetamol over compared with effectiveness of paracetamol compared with Panadol in reducing symptoms of headache among teenagers. Who are your population here are teenagers. What is your intervention? Paracetamol. What is your comparator? Panadol. What is your outcome? Reduction of what? Headache. And you see that I've just come up with a research question. Now, I've just come up with a research question. In our session tomorrow, now we will now start talking about gap, identification of gap. How do you identify your research gap? How do we know why we should do this systematically? Because one thing is to come up with all your research questions. Another thing now is to now know if it is possible for you to do it, right? Which is what we're going to do, what explain in our next session tomorrow. So, as with respect to our PICO as a model, right, is used mostly for quantitative studies. So we're going to also see other examples. Now, there's something we call scoping reviews. Don't worry, we're also going to explain that. Scoping reviews is just it's also another form of review. That is, it's similar to a systematic review, but the difference between a scoping review and a systematic review is that in a scoping review, we are mapping a wide array of literature. We can begin a scoping review that has 30 included studies, right? And for us to formulate the research question of the scoping review, we usually use what we call the PCC framework. So what the PCC framework means is the population, concept, and content. Now, it doesn't mean that you cannot use the PCC framework for a qualitative study. It doesn't mean that you cannot use the PCC framework for another type of study. It can be used interchangeably. Remember, I told you that, right? But it is widely used in what? Formulating, review questions for what? Scoping reviews, right? Good. Now, somebody might be asking, what if I'm in mechanical engineering? How does this now apply to me? We have a lot of area, or a lot of what? We have a lot of models that we use in formulating what? Other models that we use in formulating systematic. In short, I've even come up with my own model, which is going to be published soon. We call it the Sentisini model for formulating what? Research questions. The Sentisini model is well detailed. We have about 12 co-authors to that particular publication, right? So we're still trying to refine it, align it with the gold standard, and get that published. So I came up with mine. So you can equally come up with yours. So we shouldn't have a kind of limitation on ourselves, right? You can finish this training and you're now crazy. You're like, I need to come up with my own model for formulating my question, and it's going to be well suited. So you need to not just think about conducting a systematic review. We're not just thinking about conducting a systematic review, we're thinking about contributing to the systematic review process. The Prisma framework we talked about yesterday that we follow in writing a systematic review was formulated by somebody. So you shouldn't just be thinking about following it. You should be thinking about how do you contribute? How do you identify limitations in that model and come up with something? So that's what makes you a good systematic reviewer. So you see my son here, he's holding a gun, and he's trying to tell you that outside all these frameworks, there are other ones we use in research. So, like I said, there are other ones which without time I wouldn't want to explain, a whole load of frameworks, right? And we have what we call the SPICE framework. So it's all about choosing the model that suits your question, the nature of what you've thought of, right? So there are loads of them outside there. So we have the SPICE, which is the setting, perspective, intervention, comparison, and evaluation. And we have the PECO, which is population exposure, which is almost similar to what we saw, comparison and outcome. We have the FINA, which is called the feasible, interesting, novel, ethical, and relevant. So with your brain, you know that this is usually mostly in social sciences, right? So it's not really clinical like these ones here. Like we have the Eclipse, which is expectation, client group, location, impact, professional services. We have the PIC, which is the population interest, and context. So it's all about how it suits you, right? So all you need to do is what? Before you start thinking about a question, you need to do what? You need to do what? Ensure that you've identified a suitable framework that will help in shaping your thoughts. So you not just jump up with a question. The first thing you need to think is, where do I want to do my research? What is my perspective? What type of intervention does my research look like? Oh, my research is not talking about an intervention. You jump into another one. Does my research look at any population? Does it try to talk about any population exposure? Does it look at the comparison? No, it doesn't. You move to another one. You move to this. Does it talk about the population? Does it have an interest? Is it looking at the context in the time? Maybe context now here might be a certain, maybe in sub-Saharan Africa, malaria, pregnant women, malaria, sub-Saharan Africa. That is the topic. I've just come up with another topic. So, like I said, at the end of this session, we should be able to come up with what? 21,000 research questions in 1 second. They say, no. I want to look at behavior, right? Does it look at behavior, health, execution models, theories? So, just like I said, there are lots of frameworks that are recognized widely out there. You can read literature up there. You make sure that your question is well suited, to the framework. So now we're going to look at some real examples. Now, let's just look at this example before we now go into the main game that we have for tonight. Right now, this is what we call the PICO question. Now, let's just go through it. And this PICO question is looking at, does taking vitamin D supplement intervention reduce the risk of cold outcome adults compared to not taking this? So it looks as though it was changed. I changed it there. So this is PICO. PICO. Sorry. So it's still a PICO, right? So it's still in the context there, right? So this is just somebody, a clinician was thinking, oh, I feel like I need to understand if vitamin D supplement reduces the risk of common cold among adults, compared to other people who are taking supplements. So here you can look at these questions. So all the questions are displayed here. In elderly patient with arthritis population, how does physical therapy intervention compared to medication should affect pain levels, right? Look at this one. For people with chronic back pain, does yoga compared to standard exercise improve relief? So this is also another question that is very paramount to understand. So the last one, look at among pregnant women, does regular exercise compared to, so this is how a PICO question seems to be, right? So like I told you, it deals mostly with what? Comparative what? It deals with mostly effectiveness, right? So clinicians, if you're a clinician, you're doing a topic that is highly clinical, right? So it's 99% chance that you're going to use a PICO question, a PICO model to formulate your question. So you can actually give yourself a test, right? Go out there, ask your girlfriend a lot of questions, ask her 1,000 questions, ask her why she didn't turn up on her first date, check if it's going to suit maybe her first date compared to other dates that she's attended. Does it increase her chances of acceptance? So that could be what a PICO question. That could be a social clinical question. All right, I'm joking. So for the spider here, like I said, it's mostly for what? Qualitative questions. So what are the experiences, right? So that's the phenomenon of interest here of diabetic patients, which have sampled using an insulin pump, which is our what? Which is our design. That is design. Now, you remember when using an insulin pump. So this is like what formed the methodology in managing their condition, which is our exposure. So the research type, you might not really find it here. R. The R here is mostly what? Qualitative. So there's not really much time to compact, just the same, statement I'm going to put all of, this particular, slide. So how do parents perceive the benefits of vaccination for children? So this is a question that you might have asked somebody today, but you don't know that you just spat out, a research topic. So what are the views of nurses on the use of electronic health records in improving patient care? So how do cancer patients experience the side effect of chemotherapy? How do they cope? So these are all questions. So in our PEO, so we can also have our PCC, SPICE, PIC, a lot of them, right? So it depends. Anyone can go, right? So it could be quantitative or qualitative. It could be used interchangeably. So how do teenagers experience the impact of social media on their mental health? Right. So this question might not have accommodated for our design, our D. So we now infuse it into our PEO. So what is the impact of living in urban areas on the respiratory health of children, right? So how do elderly women perceive so some of these questions might be similar, right? So it's just all about coming up with a question, aligning it to the framework and justifying it, right? One thing I usually tell people in research is that there is no right or wrong in research. It's all about justification. If somebody can come up and give us a proper justification why we should use we should use a spider framework for this and justifies it properly, then we go with it. So that is just what people need to know. There is no right or wrong in research. It's just all about what? Justification. Can you be able to justify why you want to make that choice? Can you support it with literature? Can you support it with evidence why it is needed? Maybe you're trying to argue that, okay, a lot of people have answered this question with the spider framework. Now, let us answer it with a PICO and see if we're going to have a different result. So that is just what it is. So all the questions remember the questions that the dog was asking, which we are going to go back to, it all reflects. I think we can now really understand that it reflects in all this. So where do we start now? So the question now is, where do I start? How do I start thinking about my research question? Now, looking at this boy here, how many research questions were you able to formulate in your head without us knowing how he wants us to start? So looking at this boy, he's putting on a shirt, he's putting on maybe an oversized shoe. His head is very big. Probably he's suffering from maybe a clinical term. One clinical term, maybe somebody might say, maybe he's having obesity in his head. That's funny, right? Talking about obesity in his head. Or then he has a fat stomach, he's holding a stunted mind. Probably he might have some experience. Probably he's listening to a music. Probably he's depressed. That way you can come up with thousands of researches. Probably he looks like somebody that is from, maybe he looks like someone that is from Africa, or someone that is from America, or someone that is from a high income country. It can be anything. You just join those terms together and you do what? You have your research question formulated. Now let us note where we are going to start. Now look at this picture. Now this is what we call the baby approach to formulating your research question. Now this is your question here. Now these are a lot of people. How many? Now personally, looking at this, I already have 21,000 research questions figured out. Like I really have a lot of things going on in my head. Now let's assume what this baby is holding to be. This is public health. This is occupational medicine. This is reproductive health. This is communicable diseases. Maybe this is HIV. This is malaria. This is let's say this is workplace violence. This is domestic abuse. This is a whole lot of. Now let's just picture this now from this point. This is the baby holding a lot of variables in his hands, and also holding a dog, which we can say, okay, rabies. Now, what comes to your mind when you look at this? It's not enough. This is an infant. Maybe this is not a healthcare facility, right? Now, these are people. These are healthcare workers. This is also another picture. Now, let's just get this very clear now, because somebody might be asking, how do I formulate the research topic? How do I formulate the research topic? How do I come up with this? It's just very simple. It's what's happening around you every day. Now, these are healthcare research. Now, remember that when I'm talking about what this baby is holding, it could be anything. Maybe you're doing your PhD, your PhD topic is on air pollution, right? So just imagine what this baby is holding as any course that you're studying. So I'm imagining that this baby is holding public health. I study public health, right? I'm also imagining that this baby is holding occupational medicine. She's holding occupational hazards. She's holding a lot of things, a lot of variables. Now, this is what a healthcare center, right? These are healthcare workers in a healthcare center. Now, this is a population of people. Now, this could be pregnant women. This could be pediatrics. This could be old age people. This could be people aged 65 years and above. This could be a lot of things. This could be all the population you think about. You know, like, this could be your ex. Look at your ex here. She's using an umbrella. This could be your last boyfriend. This could be your wife here. This could be, this could be women of a productive age. This could be any type of population. Remember, these are healthcare workers in a healthcare setting. This is just a hospital. Now, this is also what we call food. Let's just call it anything. We could call these rice or maybe nutrition, maybe whatever thing, right? Now, we'll come to this. What this is, this means these are patient outcomes, right? These are sort of patient outcomes. This is mental health. These are people that are wearing nose masks. It's just still COVID-19. I don't just know why, right? So maybe they are maintaining social distancing in their brain, because I can only see that in their brain. Now, if you now ask the question in simple terms, let's say you just started your PhD. Maybe your supervisor hasn't given you that approach. The supervisor hasn't tolerated you. It hasn't tolerated you formulating your research question on your own, right? Now you now ask the question, come up with 12 research questions from this scenario. So I could just say occupational hazards, right? Let me say, for example, I could say maybe here, tuberculosis, patients in healthcare, right? Africa. So what comes to my mind, I could not come up with a framework, let's say my P, right? So I want to now know tuberculosis will lead to what? Death. Or will lead to what? It will lead to dysfunctioning respiratory system, or it will lead to impaired respiratory system, or it will lead to what? Maybe any type of outcome, right? So I could now come up with what? Healthcare workers, preventive measures towards COVID-19. That is it. That is one title. So I could also look at this here. I could say, okay, mental health, right? So I could now formulate my research question and say, okay, mental health care among what? Individuals in Africa. I look for a framework. Either I look for my P. What comes to my mind is my P. What is my P? My P is here. People who are diagnosed with COVID-19, right? With respect to what? Or let's say, okay, for example, here, remember I could say pregnant women who are taking what? Remdesivir. So remdesivir could be what this baby is holding in reducing what? In reducing maybe mortal outcomes or maternal, maybe any kind of mortality or morbidity, right? So it could be what? Remdesivir among pregnant women in reducing what? Morbidities. That is a research question. Maybe I can now try to put it in what? In a location. Like I said, pregnant women in sub-Saharan Africa. So when you look at this, right, you get a lot of questions, right? So let's say she's holding domestic violence, right? So I can say what? Domestic violence among what? Among maybe the individuals, or let's say among nurses. Domestic violence among healthcare, maybe, or we can say maybe workplace violence is the concept here among healthcare providers. in what? In England. In what? England. That is the title. So it's just all about playing around variables and making sure you align it with what? A question. Now let's look at another thing now. Let's say these people are experiencing their experiences of what? Of adult men towards what? COVID-19. So only looking at this alone, I've gotten a title. Experiences of adult men towards what? COVID-19 in reducing what? Morbidities. So it could be anything. So this is just a question. So what the baby is asking you now is, what are you thinking? The baby is holding occupational hazards among what? Healthcare workers in what? Kenya. She's holding dementia among what? Dementia among what? Maybe individuals diagnosed with whatever. So it's up to you. So this way now we can see that we can think about a lot of things. This what the baby is holding is your PhD area. Let's say you're doing aeronautics in physics, right? You need to think about what has other people done. What can you see? What picture can you see? That is just how it works. Right? What picture can you see? Right? So it is when you now have that clear-cut image, right, that you will now do what? Formulate your model and now align it with what? Any idea of what these models. So it is when you create, when you come up with a lot of questions, because most times you see a lot of students right out there, they just have their tutors what not really guiding them to choosing that topic. So this way now you can come up with your own model. This is what? Nutrition. So this could be what? Dietary habits among what? Among what? Children, among infants. In what? Maybe among infants aged this. So don't worry, in our next conversation, in our upcoming conversation, we will not be able to learn how to narrow down our thought. So just think of the picture. Think of the picture and fetch yourself what? With the right model. I'm sure it seems so clear to each and every one of us. Now, what are other areas outside looking at the big picture? How you can actually formulate your research? It could be an experience, right? It could be an experience you had with your what? You had with your partner. She was so abusive. Oh no. Maybe she was so nice and all that, right? So you might try to do what? To review literature among what? Domestic violence, among what? Among early stage couples in what? In Nigeria. We can come up with 21. I want us to be able to come up with 21,000 research questions in 1 second. So it could be your supervisor, maybe the way your supervisor parked his car. And you're now thinking about maybe does overcrowding lead to, or the overcrowding of cars lead to financial motivation? That could be a question. You look for one model and shape and align your thoughts. Now it could be based on the current trend. What is happening now? Because when the COVID-19 started, literally everybody has started having publications. When the COVID-19 started, we had a publication, we had a systematic review publication, that we wrote. That was on, we looked at the efficacy of remdesivir in reducing outcomes, in reducing mobility outcomes, among pregnant women. So we look at the efficacy among pregnant women who were diagnosed with COVID-19, right? So that was practical what we looked at. So it's just very simple. So when you look at those, when there is a current trend, right, you see a lot of people having research questions. Remember that research question is also the same thing as topics. Yeah, I told you the same thing. You see a lot of people formulating one research question around it. So it could also be another area to you to find the big picture, outside the baby approach is what? It could be gap in literature. What has not been done that you feel like you need to do now? So also, it could be what? Maybe community feedback needs in your community, there is no water. And you're very crazy about it. Like, you're like, what's really happening? So you want to do, you want to complete a research question maybe on needs assessment. And that's a very fantastic research question, right? You see, most people actually struggle. I've actually conversed with so many of them, and they are really struggling because they don't really get the fundamentals. They don't really know their paradigm, where they're standing on top of how they came up with the research question. So you see that it's very difficult. You're very disadvantaged because your supervisor will just give you a shitty topic, just give you what he or she likes you to do, and you're in trouble. You just have to find a way to either convert it to your experience or into a baby approach. So it could be also, like I said before, it could be experience you had with your ex, maybe, right? So I've never had an ex, and I don't really know how it feels like, but I'm sure most of all, like we could actually have experience with people, and that really impacts on how we shape our topic. Maybe probably somebody you had an experience, maybe your uncle died of diabetes, you now feel like you want to, maybe he was taking a certain class B drug, for type 2 diabetes, and you now want to understand the effectiveness of that class B drug compared to the other ones. Why was he not taking the other ones? That way you come up with a pico question because of the experience you had with your uncle. So now we are already at the end of this session. I'm sure we can't really wait to start bombarding me with our questions. So we have a lot of practice questions out here. I'm sure it was a very fantastic session. We can now start coming up with loads of questions, right? So now, 1, 2, 3, 4, right? So we look at impact of air pollution on respiratory health in urban children. So here now we look at our urban children is our P, right? Now, air pollution is our what? Is our exposure, and respiratory health is our what? Outcome. That's the impact on the respiratory health. So we use a what? A PEO framework. So we're going to also look at this one, experiences of elderly patients with chronic pain, right? So the experiences here could be of chronic pain, could be our outcome. Our exposure could be what? Chronic pain. P is our elderly patient. So it can also be used interchangeably for the spider and all that. So I'm going to also talk about other ones. So look at the efficacy effect of stress. So we are left to answer that, in our Q&A session. Efficacy of a new diabetic medication in reducing blood sugar in adults. So for us to check the efficacy of this new drug, of this medication, that means we're going to compare it with another drug, right? And reduction in blood sugar levels is our what? Remember, these are all topics. I decided to put them as topics so that we don't go out of board, so we have a clear understanding. So these are all topics, so there are still questions, right? So reduction in blood sugar levels is our what? Outcome, and adults are what? Our population. So these are a lot of practice questions put out there for us. So we've got to really go through these questions and actually have a blast about it. I'm sure we're really excited about this session. We can't really wait to start formulating our questions. So I want to thank you guys very much, for keeping up with this session. So just a brief, I'm going to have a rundown of what I've talked about, before I start asking us, questions. So we started by introducing myself, David Innocent, and also we talked about the research question. For those of us that might be joining, we talked about research questions and systematic reviews. We talked about types of research questions. We also explained the models and frameworks in formulating research questions. We had a detailed baby approach, an infant method of conceiving a systematic review question, and we looked at examples and practice questions. Now, we had a dog, a very fat, sweet dog that was asking us about our question. And suddenly we saw that the dog was married, like happily married. Now, let's get back to these questions that this dog was asking. I'm sure we can now be able to figure it out now. You look at this question here, it was the spider framework. what do couples who attend premarital counseling think about the benefits of this session for their future marriage? So this was what pure spiral framework, right? To have for newly married couples population was attending premarital counseling intervention compared to not attending comparison, improve marital satisfaction, which is an outcome in the first 3 of 9. So we also had the dog asking a question of how do newly married couples, which is a population who face early financial stress, which is our exposure, experience their relationship in the first year of marriage. They also understood that we also attended a question for the PCC framework, which is widely used for scope reviews, who can also be used interchangeably, right? So you're free to do whatever you want to do. So it asks for couples planning their wedding. What are the common stress factors during the planning process? So we also explained what a systematic research question is, where we said that it's something that is clear, right? So it's clear, focused. We just try to explain it as somebody who has a lot of cars that are running. So trying to understand which of the cars goes fast is just asking a question. So we looked at it wasn't different from what we talked about systematic review for the research question is systematic review, where we said that the research questions are just like a lot of big thing, right? So we just want to get the best answer. Cancer in Africa, what's it like? Very big. So we're going to review studies, cancer in Africa, from diverse locations. So we also tried to, before we entered into, the various models used in formulating research questions, we talked about the types of research questions, right? We talked about the quantitative being numerical, deals with cross-sectional studies, uses questionnaires, all types of surveys, experiments, and all sort of, any type of study that tries to generalize. Because you come to your school, let's say you're schooling in university in Tanzania, right? Dodoma University in Tanzania. You want to do prevalence of diabetes amongst female students in Dodoma. That's a very large question. So it means that you need to, it's quantitative, right? So that's like quantitative research. So for qualitative, we talked about it explaining, experiences and all that. So maybe really, really clear, right? So talking about interviews and all form of information that lacks numerical precision. And we also talked about the mixed method approach, which is trying to combine the quantitative and qualitative. So that's the type of research question that tries to combine these both. So we made that as an example. So we looked at how to formulate a research question. Also, we talked about the spider model, which is very clear. It's a sample, phenomenon of interest, design, evaluation, and research type. So we just use the spider frame. We made it very clear that for you to start thinking of any question together with your loved one in the room, let's say after this meeting, you want to start talking to your baby, you need to ask, hi baby, what model are we going to use to ask ourselves questions? So you make it very fun for yourself. So we said you might use the qualitative. So if you're doing a qualitative research study in your PhD, it's going to be pure spider. Spider is really advised PhD students using spider. So we looked at the PEO, which is also, we can be used interchangeably. Look at this very beautiful dog. I would love to, the PEO frameworks, right? We can use it for any of them. So you can use any model, but it's all about what? Justification. You can use the PEO to structure a qualitative question. You can also use it to structure your quantitative question. So it means that even if you're an undergrad, whoever you are, you should have a model to formulate your research question. Even if whatever type of research that you're conducting must be based on a question. But we also talk about the PICO framework, which is usually most for quantitative studies. When we talk about the quantitative study, it's not just a clinical study, right? So if you remember the second question that the dog was asking about, counseling section, that question is not really clinical, right? So it's just any type of intervention comparison, right? A PICO model is very suitable. So which we talked about, and we explained it in simple terms. So we also explained the PCC framework, which is widely used for scoping reviews. We've made it very beautiful, clear that for you to do your scoping review, you need to come up with the very decent framework, right? So it means that everything must have a framework. Most times undergraduates, you just start your project, you just list your topic. The next thing is you start listing your specific objective. The next thing you convert your specific objective into questions. The idea is that your topic needs to be formulated with a model, and it's not different from what we just talked about. So we also consider other type of frameworks where we look at the SPICE, the PICO, the FINA, Eclipse, PIC, and the model. And so I told us that I am also coming up with my own model, which is known as the Centesimi model for formulating. So my own research, my own model is going to accommodate any type of design, right? So it's a very wide tool, and it's still going to get out for publication. So we look at numerous questions, right? We just look, real questions, PICO, SPIDER, and PEO, right? Specifically, we just try to have a clearer understanding of what real-time research questions looks like, and which was what we explained, 3 of them and all that. So for those of us that were confused, so we just have a very clear overview of how to start. Then we're like, oh, looking at this boy, we can actually identify thousands of questions that we cannot wait to start answering. Where I made it clear to us that at the very end of this session, we should be able to formulate 21,000 research questions in 1 second. So we have a very clear picture here where we call it the baby approach, right? So this is a baby that is carrying a lot of variables, right? So this is a hospital facility. This is healthcare workers. These are a population of people who can be anything. They can be pregnant women. They can be neonatal. They can be pediatrics. They can be adults who are suffering from diabetes. They can be any type of population in this world, right? So this is also another type of population of people who are putting on masks, or people who are suffering from whatever disease. And these are outcomes. So it's all about merging your thoughts, right? So we can also have a more clearer and larger picture out there. So it's formulating a systematic review question. It's all about merging our thoughts, right? So this can also represent country. This could be Ghana, this could be Imo State, this could be Nigeria, this could be low and middle income countries. Remember, it can be in your topic. It can be the topic of low and middle income countries. It can be the topic of high and middle income countries. It can be the topic of Canada or any type of population, right? Or policy settings. Then we now agree that there are other paths to identification of research where we talk about personal experiences, supervisor suggestion, maybe current trends and issues in the field or what is happening, the gap in literature. Maybe your supervisor has this can also link to this. Maybe personally as a PhD student or as a researcher, you found the gap in evidence. Maybe people are talking about anemia. People are talking about anemia, but nobody is talking about anemia in women. People are talking about anemia among children, for example, but nobody is talking about anemia in women. That is it. And if it's a gap, it means that you need to do what address that. So we also talk about that you can also get idea pack for questions from the community feedback needs and other, and also from your very good girlfriend who is thinking of serving you wedding invitation next. So we just put out a practice question. I'm going to share this slide to us to our various emails. We can now match all these questions. These are practice questions out there for us to choose. So we can actually choose based on your understanding of this session. And in our last day, on Wednesday, we are going to get based on these practice questions that we put out there. And these are also other questions that we also embedded into our plan. So thank you very much. We love you guys so much. I would want to entertain our questions. I don't know if there are questions. I'm sure the class has been made very, very detailed. It was really a pleasure to have each and every one of us in this session. So without wasting much of our time, please can you come up with your question? How was the session? Let me look at the chat box. Okay, yeah, I can
Thank
look at
you.
the chat.
Can I ask my question, sir?
Yeah, go ahead, go ahead.
Thank you very much for the wonderful session. Mine is just a question regarding systematic Prisma flowchart. That flowchart we are using, is it compulsory for every research to use that flowchart? Because I have been seeing some systematic review and meta-analysis that analyzes different findings from different publications, and they have not been using the flowchart. And sometimes I used to see the flowchart with a little bit kind of modification by the author. Is it allowed, or someone can just do it that way? Or
Okay, all
that's
right.
my question.
So yeah, good. That's a very good question. Okay, what we are addressing today is clearly, you know, research questions, right? So, like I said, the Prisma, like I said in my last session, right? The Prisma checklist is a tool that you need to follow, that you could follow. There are other tools outside the Prisma flowchart, right? We have the grad, what we call the grad checklist. We have the Amstar checklist. We have a lot of them out there, right? We have the Robin scale and all that. So these are all flow charts to follow. So, but at this point now, what we need to understand is how to formulate a systematic review question. Then when it now comes to our methods, right? That is where we will now explain all the components of the systematic
Okay,
review flow charts.
I
Yeah, thank you very
understand.
much. Yeah.
I understand.
So I don't
Thank
know,
you
is there
very
any
much.
other question before we call it a night? I'm sure we are.
Yes, good evening, sir. Please, I
Yes.
have a question.
Yeah. Elizabeth.
I don't know if the guy, the Mohammed can mute his mic because it's kind of interfering.
Okay, please, can you mute your mic? Mute your mic if you're not, if you don't have
Mhm.
anything.
All right, thank you, sir. Thank you so
Right.
much, sir, for this like wonderful session. It was really, really eye-opening. I have two questions. The
Okay.
first one is I didn't really get the difference between in the spider model. I didn't really get the difference between phenomenon of interest and the evaluation. And then the second question is how must all research question, that's topic now, be involve a particular population, because most of them that you've been talking about you specify to a particular population. How does a research question like this, for example, effect of ascorbic acid and on therapeutic on therapeutic efficacy of anti-malaria, like which model does that kind of
Okay.
question fit into?
All right. That's a very great. That's a very great question. Now let me start from your last question, right? Now, when we go back, when we return back here, right? You find out that there are actually lots of models out there. Now, when you look at this behemoth model, right, it doesn't really have anything to do with any population, right? When
Okay.
you look at the final model, so these are this most of the models we've we've actually shown out here are mostly for healthcare research, right? But it doesn't mean that there are no other models out there. There are loads of models. So for you to formulate your question, there needs to be a framework that is guiding how you have made your choice. So whether you're doing an experimental or laboratory study, right? It's just
Yes.
something that we don't really know about. We don't usually talk about. We just come up with topics, right? There should be more like a concept. There's also what we call the CC framework, which I didn't mention here. So that framework looks at more like the context and concepts. So it is now when you go through the dynamics of all these frameworks, right, that you now see that okay, this is the root of my this is where I'm
Research.
looking at my observation or my experience or my intent to go into the field or to go into the laboratory from, right? So, but the idea is that all research questions in this world or in this life must be what must be
Following
based
model.
on a model. So you just go out and look up. Like I said, There are a lot of other models. I could continue listing a whole lot of them. Right. So, but the idea of all these things is just to, is just to have more like a, um, like to help accommodate any type of question that you have. So even your research question could also have, you can actually really describe your question and it falls into a spice, a spice from. It's all about justifying it, justifying why you have actually chosen it, right? So just to
Okay.
go out there, make a lot of research and to find those things out. So now your other question now is about the phenomenon of interest. Now when you go back here, now let's get this clear now. Let's get it clear. Now your phenomenon of interest now is debating what we are interested in. Whereas your evaluation is the same thing as the outcome. So let me give another example now, right? So let me say, when I'm interested in, let's say, for example, now, want to know experience of teenagers. How do teenagers perceive going to the moon? Like, how do they perceive going to the moon? For example, now I'm just trying to use a very weird, question. How do teenagers now perceive going to the moon, and how does it affect them? Maybe how does it affect their their BMI, for example, now? In that situation now, right? So what we're interested in now is what? We're interested in their experience,
Okay.
or what maybe them perceive, how they perceive going to the moon. Then our outcome is going to be, what are we now going to find out? What will be in our result? Now, another clearer way of understanding this is that usually in your systematic review results, there are something we call themes, topics, outcomes that forms the headings in your results. So those headings
Okay.
are usually your evaluation. That is even where you get to
So
see
if
it.
I'm understanding this right, oh sorry.
Okay, yeah, fine.
If I'm understanding it right, the phenomenon of interest is more like before the experiments, while the
Absolutely.
evaluation is like after the should I
So
say research or something.
yes, result. But remember that experiment is more quantitative, so we don't get
Okay.
confused. We don't try to use
Okay.
the quantitative example to start forcing it inside a spider framework. That is why we have.
Okay.
That is why when when you are finding it difficult, you also have the PEO framework, which is very clear. You just have the population, the exposure, and outcome, right? So
Okay,
you
sir.
don't use
Thank you
the
very much,
quantitative
sir.
beautiful. So you don't use a quantitative product, start forcing it into a spider, it won't really work, and it will create more confusion for you. So I'm going to take one more question and we call it a blast. Thank you very much. All right. I don't know, is there any other question? Mohammed Bello. Okay.
You have responded to my question, sir. Thank you
Oh,
very much.
beautiful. Oh, beautiful. So it's 9:30 already. Just thank you very much, guys, for today. I hope you really enjoyed it and had a very nice day.
Thank you, sir.